Sardines are often promoted as a nutritional superfood, and from a purely micronutrient perspective, that label is understandable. They provide high-quality protein, long-chain omega-3 fatty acids that support cardiovascular and anti-inflammatory pathways, vitamin D for bone and immune health, and calcium when eaten with their soft, edible bones. For people without uric acid issues, sardines can fit into a balanced diet. However, for anyone who is prone to gout, has elevated uric acid, or struggles with recurrent inflammatory joint pain, sardines represent a disproportionate risk relative to their benefits and should be approached with significant caution. The main problem is their very high purine density. Sardines are small, metabolically active fish, and because purines are concentrated in rapidly dividing and energy-intensive tissues, sardines deliver a large purine load per gram of food. Once consumed, these purines are rapidly broken down into uric acid. In people with impaired uric acid clearance, whether due to genetics, kidney inefficiency, insulin resistance, dehydration, or medication interactions, this can cause a meaningful spike in blood urate levels. Even when sardines are eaten in amounts that seem modest by normal dietary standards, they can still push uric acid above the saturation point at which crystals begin to form in joints and connective tissue. This risk is not theoretical. Oily fish such as sardines consistently appear near the top of lists of foods associated with gout flares in both clinical guidance and epidemiological studies. Frequent consumption, especially several times per week, has been linked to higher gout incidence compared with lower purine protein sources. The danger increases further when sardines are consumed during periods of stress, illness, dehydration, alcohol intake, or caloric excess, all common real-world scenarios that independently impair uric acid excretion. For someone already walking a narrow line between stability and a flare, sardines can act as a trigger rather than a neutral food. Can sardines introduce additional concerns? Many are preserved in oil or salty brine, increasing sodium and caloric load, which may worsen blood pressure, fluid balance, and kidney workload. High sodium intake can indirectly affect uric acid handling by the kidneys, especially in people with hypertension or chronic kidney disease, conditions that frequently coexist with gout. Oil-packed sardines can also contribute to excessive caloric intake, which over time promotes weight gain, insulin resistance, and higher baseline uric acid levels, compounding long-term risk rather than mitigating it. Another issue is the false sense of security created by sardines' anti-inflammatory omega-3 content. While omega-3 fats do have beneficial effects on inflammation, they do not cancel out the uric acid-raising effect of purines. Many gout-prone individuals assume that because sardines are anti-inflammatory, they must be protective for joints, but gout is driven primarily by crystal formation, not by general inflammation alone. Once uric acid rises and crystals form, the inflammatory cascade follows, regardless of how many omega-3s were consumed alongside them. From a practical standpoint, sardines are best treated as a rare food rather than a regular protein or fish option for people with gout or hyperuricemia. Large portions, repeated weekly intake, or use as a staple fish choice substantially increases risk. Eating sardines during or immediately after a gout flare is particularly unwise, as uric acid levels are already unstable and the likelihood of prolonging or intensifying symptoms is high. Cooking or canning does not meaningfully reduce purine content, so preparation method offers little protection. Safer alternatives can provide similar nutritional benefits with far less risk. Lower purine fish such as salmon, in moderate portions, trout, or white fish like cod and haddock are generally better tolerated. Omega-3 intake can also be supported through purified fish oil or algae-based supplements, which do not contain purines. Calcium and vitamin D are more reliably obtained from low-fat dairy, fortified foods, or supplements when needed, without exposing joints to repeated uric acid spikes. In summary, while sardines are nutrient-rich, they are a high-risk food for anyone with gout or elevated uric acid. Their concentrated purine content, frequent association with gout flares, and added sodium and caloric concerns when canned make them a poor choice for regular consumption. For gout-prone individuals, the safest approach is to avoid sardines entirely or consume them very rarely, in small amounts, and never during periods of active symptoms. Long-term joint health and uric acid stability are better protected by choosing lower purine protein sources and viewing sardines as an exception, not a health staple.